Welcome back to Ocala Talks on a Wednesday. You know, expectant mothers, there's a lot going on in the minds of expectant mothers, as there should be. They have a new baby on the way. You know, if you're an expectant mother, stop what you're doing and listen to this for just a few minutes. With all the anticipation and excitement of a new baby, the one person that gets forgotten, the one key element that gets forgotten when making a birth plan is mom. Too often women don't talk to their doctors about ways to improve recovery, steps to take and maintain a strong body, and manage postpartum pain. Joining us now live is Dr. Marcy Crouch and Dr. Uma Shastri to talk to us about that exact plan. Good morning, doctors.
Good morning. Thanks for having us.
You know, I just actually had a family friend, a very close family friend, that 3 days ago had a very healthy baby. She just gave birth, and we were, we had dinner with them and all during the pregnancy and everything, and there were plans made for the nursery, and there's plans made for, when people get to see the baby and everything. But you're right. I went back and thought about it. Never once was there a plan about how mom was going to lose the extra weight that comes with a baby, or what mom was going to do, because now she's at home and she's not doing her job. She's on maternity leave, so the challenges that gives. Why is it, doctor, that you think, Dr. Crouch, why is it you think a lot of women, they think about everything except themselves during this time?
Yeah, I mean, that's such a great question. I feel like we could write a PhD dissertation on that. But I think there's a lot of reasons here. One is that the focus really is always on the baby. It's very infant-centric, right? This is why we have all these appointments during pregnancy, and then after the baby comes, moms only get one appointment. And the focus really is on what we need to pack in our hospital bag and what the nursery looks like and all of these other issues. But what happens is that moms start to get forgotten, and they deal with a lot of physical issues after having a baby that are considered normal, even though they're not normal, but in fact common. And some of these issues are leaking urine, pain with sex, abdominal muscle separation, core weakness, C-section scar pain and hypersensitivity, and so many more. And women deal with these physical issues for years after having a baby. It's not just this 6 weeks after delivery. It can be years and sometimes compounded after they have more babies.
Dr. Shastri, when we're talking about recovery after the baby's been born, a lot of people forget there's still pain associated with some of that, pain management associated with that. What should women be discussing with their doctors in preparation for their delivery, especially where if they're planning a C-section or if they have an unplanned C-section?
Absolutely. Great question. So all women, no matter how they deliver, want to get home as soon as possible. That's one of their main goals. This is obviously harder for C-section moms because C-sections come with more pain. Yet these moms are still expected to get up, walk around, hold their baby, feed their baby, and look after themselves all within the first 24 hours of having a surgery. A lot of times with C-sections, especially unplanned C-sections, the pain is primarily managed with opioids. And opioids come with a laundry list of side effects that can delay recovery: nausea, vomiting, constipation, drowsiness. So I really encourage all moms early on in their pregnancy to talk to their doctors about non-opioid options, especially if they end up in a situation where they need a planned or unplanned C-section.
When you talk about alternatives to opioids, what are some of the alternatives to opioids, Dr. Shastri? And what happens if the OBGYN or the doctor you're going to doesn't offer those alternatives? What should you do then?
Yes, so there are a lot of options. In my practice, I like a medication, Exparel. It's a long-acting numbing medication that we inject right into the surgical site at the end of the procedure after the baby's out. It lasts for a few days when the pain is at its worst. And often with Exparel on board, women don't usually use any opioids, and if they have any breakthrough pain, it's usually managed very well with just acetaminophen. You can learn, or women can learn more about Exparel at exparel.com/safety. Now, you do bring up a great point. If your doctor doesn't openly talk about options, I think it's important for women to start the dialogue and really talk to their doctor about their recovery goals. And I think they'll be pleasantly surprised that their doctor does want to work with them to meet their needs and what they want.
Dr. Crouch, what are the benefits of an opioid-sparing recovery after childbirth? I mean, that's whether it's through physical therapy, use of non-opioid options during and after delivery. What are some of the benefits?
Yeah, there are so many benefits, and this is a really, really important topic. So things to kind of keep in mind here when we're talking about recovery and pain management after having a baby. These tissues, whether it's vaginal tissue or abdominal tissue when you've had a C-section delivery or a vaginal delivery, if you've had any sort of trauma or tearing in the vaginal wall or episiotomy performed, these are major things that happen to muscles and nerves and fascia and skin. So we really want to try to minimize any sort of other negative effects like side effects from opioids from constipation, nausea, vomiting, because it just puts a lot of pressure on these tissues that are already sensitive and are already trying to heal from this kind of like trauma from delivery. So physical therapy, being a pelvic floor PT like myself, having options for pain management to really support the tissues and learn how to start to recover the right way from like minute one. Like once that baby is out, these moms need to know how to move their bodies and how to poop the right way and how to lift the baby and where they should be, holding when they're feeding and how to decrease pain and kind of all these things that nobody really talks about, but really kind of can influence long-term recovery, acute healing, and quality of life because it hurts. Like your body hurts after having a baby, and we really need to support moms better and give them more options in this particular time frame.
Dr. Crouch, you alluded to earlier that this is not something that may be a short-term situation, that this could last for more than weeks. It could last for months. Postpartum could take a while. Is all of this effective over the long term?
Yeah, I would say it would. So it's really important to kind of distinguish like acute and kind of long-term stuff. But there are tons of studies that show that women have residual effects like leaking, pelvic pain, prolapse, all through their lifespan after having a baby. It's not like you just start leaking urine 6 weeks postpartum and then it goes away. So I tell my clients all the time that postpartum is forever. So we need to really be supporting and rehabbing these tissues, pelvic floor muscles, C-section scars, the entire body of the parent and birthing person from that first day in the hospital. And we can see a lot of decreased long-term issues once we even start preventatively. Like I like to see clients when they're pregnant, even before they have problems, to decrease the risk of tearing and trauma and improve postpartum recovery long-term.
It seems like a subject that sometimes women forget to ask, and the subject is themselves. Dr. Crouch and Dr. Shastri have been here making sure that women think of themselves in the pregnancy process, because they're part of it too. It's not just about the baby. The women are part of the process as well. Dr. Crouch, how can people get more information about this very important subject?
Yeah, they can visit www.wearewomenshealth.com to learn more and get a ton of great resources.
Dr. Crouch and Dr. Shastri, thanks so much for shedding some light on a very important subject that sometimes gets, not thought of, and that's the women themselves during pregnancy. Thanks so much for being here, and have a great rest of your day.
Thank you. You too.
That's one of those situations that, a lot of times people think it's just about the baby. And, the recovery of the mom is very important as well. We'll be right back after this timeout. You're listening to 1370 AM, 96.3 FM. This is WOCA, The Source.
Broadcasting from the Ocala International Airport, this is WOCA AM, W242CA FM, Ocala, 1370 AM, 96.3 FM, The Source.
USA Radio News with Lance Pry.
Floods unleashed by days of heavy rain have wrecked crops, blocked roads, and washed away bridges throughout India since Friday. Dozens of souls have lost their lives in the weather. Officials said on Wednesday rescue efforts continues for those stranded. There's big money in the vaccine business. Johnson & Johnson registered $502 million of global revenue from its COVID-19 vaccine in the third quarter, bringing year-to-date vaccine sales to $766 million. J&J, which sells the vaccine for $7.50 per dose, still expects to generate $2.5 billion of COVID vaccine sales this year. Production of the Ford Mustang Mach-E began in China on Monday as the automaker looks to